seconds or so. Okay, good morning, good afternoon, good evening, everyone. Welcome to today's webinar. My name is Panya Yu, and I will be moderating today's session with my colleagues Hao-Yi Chen, Alexander Loschke, and Sean Lowell. This is a webinar jointly organized by the Global Network of Data Officers and Statisticians, along with the Inter-secretariat Working Group on Household Survey at the United Nations. The Global Network is a professional network of over 3,000 data officers, statisticians, geospatial information experts. We use our network to share expertise, capacity building, and best practices through our Yammer group, as well as this bi-weekly Global Network webinars. If you're not a member already, please join us at yammer.com/UNstats. I will put a link in the chat later. So before I actually introduce the topic and the speakers, I just want to invite my colleague Hao-Yi to say a few words about the Inter-secretariat Working Group. The floor is yours, Hao-Yi.
Thank you, Panya. Thank you for the collaboration. It's always been a pleasure to work together. A few words about the Inter-secretariat Working Group. It's a group that was established by the UN Statistical Commission in 2015 for us to work together on improving survey coordination at different levels, global, regional, and country level, and also to really move forward on innovative approaches. I believe this is one of the areas that we very much wanted to see how quantitative data from surveys can be really put together with qualitative data to give a real picture of population groups. I would also like to really bring this together with the other area of work that I've been leading at the UN Statistics Division, which is the work on the citizen-generated data. We had an expert group meeting last week in Copenhagen, and on this topic, on the conceptual framework and how to operationalize the conceptual framework on citizen-generated data, one of the most commonly raised question was data quality. How do we work with data generated, produced by civil society organization, which is often qualitative data? So there was a lot of guidance requested on how to assess the quality, how to work with qualitative data, and how do we really bring them together with quantitative data. So thank you so much for our guest speakers, and really appreciate your help. Now back to you, Panya.
Thank you. This is indeed a very interesting topic, and we are delighted to have speakers from the UK Office of National Statistics. They are going to be giving a presentation on qualitative research with statistically underrepresented groups within the ONS in the UK. So a bit about the topic. Qualitative research methods typically involve the collection and analysis of non-numerical data, such as people's accounts of their experiences, needs, and priorities and perspectives. Their inclusiveness and ability to help researchers understand nuanced topics and maintain rigor with sample sizes much smaller than typical statistical research makes qualitative research perfect for investigating the experience of groups who are typically underrepresented in survey data. The ONS team uses qualitative research to help understand the lived experiences of groups and communities who may not be otherwise counted due to issues of trustworthiness being missed via the traditional data collection pathway, or the inability to disaggregate due to small sample sizes. So the team that are speaking today have carried out 5 projects over the past 3 years, working with groups identified by the Inclusive Data Task Force as underrepresented in UK data. And I am very grateful to them for sharing an overview of their work with all of us today. So let me quickly introduce our speakers. Dr. Amber Jordan, Alex Buckley, Shonan Kerrigan, Heidi Smith, Jenny, and Dalmini Bromond are all members of the qualitative research team within the Center for Equalities and Inclusion at the ONS. Their research interests center around using qualitative data to investigate inequalities and to drive inclusion. And between them, they have worked with multiple groups at risk of disadvantage, such as children and young people, including those with special education needs and who have been geographically displaced, gypsy and traveler communities, adults with disabilities, and survivors of domestic abuse. So before we actually go into the program proper, just a few housekeeping rules. Our speakers will have anywhere between 35 to 40 minutes for the presentation, and that will be followed by a Q&A session at the end. Throughout the presentation, please feel free to write your comments and questions in the chat box at any time. And of course, during the Q&A session, we encourage you to actually ask questions directly by turning on your camera and unmute yourself. As always, this is being recorded, and the recording and the presentation slides will be made available on the global network. We hope you will continue the discussions there after this session. And with that, ONS colleagues, we very much look forward to your presentation. The floor is yours.
Thank you so much, Panya, and hi everyone, and thank you all for having us present and for everyone for attending. As Panya said, my name's Amber, and I'll just start by telling you a little bit about our team. So we are the qualitative team within the Centre for Equalities and Inclusion in the UK's Office for National Statistics, or ONS, and we're one of many qualitative teams within ONS. So other qualitative teams also include, user research teams or survey development. But our team, which was established 3 years ago, we specifically focus on providing evidence and insights where statistics may be unable to do so, working with groups that have been, as Panya mentioned, statistically underrepresented. So these are people less often included in our data and evidence, and it could be for that range of reasons, like not being picked up in household surveys if they maybe are non-household populations living in communal establishments, for example, or perhaps they are less likely to choose to participate because of trust or trustworthiness. So we also, we work to implement the recommendations from the Inclusive Data Task Force. And this included identifying the specific statistically underrepresented groups that that kind of form the base of our projects. Just to tell you a little bit about the Inclusive Data Task Force. So in 2020, the UK National Statistician, Sir Ian Diamond, convened this group. It was a diverse group of senior academics and civil society leaders with a wide-ranging expertise across equalities topics and methodologies, geographies, and data ethics in the UK. So the goal of the task force was to ensure that data and evidence across the UK is reflective and inclusive of all. And the outcome of the task force was to create these recommendations for us to start trying to implement within our work packages. So throughout 2020, it was our team that actually implemented a lot of the work for the task force. So engaging with members of the general public of different equalities groups, academics and civil society organizations, and different areas of government on the topic of inclusivity and data. So using these findings reports that we produced as part of the supporting evidence, the Inclusive Data Task Force published these recommendations in 2021 on how best to improve inclusivity in UK data and evidence. And then, so ongoing work around the recommendations in 2022 was the first implementation plan that was published. So this summarized any sort of known or current planned initiatives to implement the recommendations. So it included our ongoing work. And then this year, an annual review was published, which outlined any sort of progress towards the implementation plan to increasing inclusivity of data and evidence. And so since the task force was concluded, we now currently have the National Statisticians Inclusive Data Advisory Committee, and again, similar kind of members from similar backgrounds. So this is ongoing. They have ongoing meetings quarterly to provide this independent advice on data inclusivity and to monitor and review our progress towards the recommendations. So just to talk a little bit about what these recommendations are and how we actually work to implement them, here's a few examples. So one is around kind of creating that environment of trust and trustworthiness, so that allows and encourages everybody to participate. So we'll discuss a little bit how we do this throughout the research process. But we engage with lots of different groups, make lots of efforts to ensure that our research is participant-centered and is accessible to a wide range of participants. Also taking a whole systems approach, so having different working partnerships rather than working in silos. So again, we have advisory groups that we work with across academic and civil society professionals, policy colleagues that we meet with regularly to ensure that, you know, our work is going to be of relevance to current policy and policy decision making. We want to ensure our groups are robustly captured by using different participant-led approaches and any sort of efforts to overcome any sort of barriers to participation. So making sure our methods are really inclusive and that we have the right means in place to include everyone. Ensuring the appropriateness and clarity of the concepts that we use in our work. So we work with our harmonization teams and topic lead experts, as well as our experts by experience groups, so those who have lived experience of that's similar to the participants that we work with, to ensure that they also think that the language and terms that we are using is appropriate. Using a broad range of methods as well to understand experiences. So we'll talk about some of the more creative or flexible and participant-led methods that we've used. And finally, ensuring that the outputs that we produce from the research are accessible, particularly to those who have participated in our research. And again, we'll talk about some examples of what we've done to produce the accessible outputs. So I'm just going to pass you on to Jenny now. She'll talk about some of the groups that were identified by the Inclusive Data Task Force as being underrepresented in our data, which kind of form the basis of our projects.
Yeah, so in response to the Inclusive Data Task Force recommendations, we've completed or are in the process of completing a total of 5 qualitative research projects so far. So our projects on disabled people's experiences with activities, goods and services, the educational experiences of young people with special educational needs and/or disabilities, and the lived experiences of gypsies and travellers. They were all published last year in 2022, whilst our project on the lived experiences of women survivors of domestic abuse in temporary safe accommodation is due to be published this upcoming winter, and our project on the lived experiences of displaced young people in England is expected to be published by spring next year.
So I'm just going to be doing a bit of an overview of qualitative research more generally and some of the qualitative methods that we use. So qualitative research involves the collection and analysis of non-numerical data. So the focus is to collect data which is rich and in-depth. So it does not aim to be generalizable or representative, unlike quantitative data. This means that sample sizes are often much smaller. Qualitative methods are used to explore people's experiences and perspectives and to help to understand the world from the point of view of its participants. Our work within the qualitative team focuses around understanding the priorities, needs, perspectives of a range of statistically underrepresented groups and exploring why and how some groups may experience greater disadvantage. Through qualitative methods, we aim to ensure more marginalised voices are heard in data and evidence. So we conduct research with these populations by using co-productive and participatory methods rather than conducting research on populations. Depending on how specific your research questions are, the methods that are used can range from being very structured, such as free text responses on a survey to address specific research questions, to more participant-led methods, which we tend to utilise more within our team, which enable participants to talk about what they feel is most important to them, rather than confining them to predetermined questions. Some commonly used participant-led methods for conducting qualitative research include interviews and focus groups. So interviews can range from being fully structured for addressing specific questions to semi-structured and unstructured, where allowing greater flexibility for being more participant-led. Interviews generally involve one-to-one discussions, which can be held in person, online, or over the phone, and allow you to understand in-depth views and/or experiences of a participant on a particular topic. Focus groups involve facilitated discussions with a group of participants who may have shared experiences or characteristics which are relevant to the research topic. Focus groups can be really useful when you want to gain a breadth of understanding and experiences, and group dynamics can really help to promote discussion and generate ideas as well. We do use some more kind of creative methods as well in some of our research projects that Jenny outlined, but we'll discuss these a little bit later in the presentation. The transcripts from focus groups and interviews will provide a descriptive account of experiences, but do not provide analytical explanations. So as researchers, we have to make sense of the data by sifting and interpreting them. So during data analysis, we're looking for general statements about patterns, relationships, and underlying themes. Inductive thematic analysis is a method that we've used extensively within the team. So this method involves identifying key themes from the content and generating interpretations from these themes. We have developed a step-by-step guide for inductive thematic analysis to ensure quality, consistency, and rigour and reduce risk of bias, which includes built-in quality assurance processes such as multiple researchers coding a number of transcripts to develop the initial coding framework. Once the coding framework has been developed, we use qualitative analysis software to code all transcripts, and from this we can begin the writing up process.
When scoping and designing research, we have early conversations with policy and research experts across each topic. This is so that we understand how our research could fill policy gaps and research gaps. We have advisory groups for all projects where we consult with community groups directly, as they are best situated to talk about their experiences. For example, we have an experts by profession group made up of influential civil society organisations. Those in domestic abuse support field and academics who we meet with throughout the project, and they advise on methods, ethics, and framing. We also have an experts by experience group who we met with once before the data collection and once after to get their input on focus and interpretation of analysis. These discussions were used to understand the range of participant needs and to ensure these considerations were built into the design from the outset. We have learned about appropriate methods for each project, such as how to gain access to groups and build trust. Engaging with community groups has provided us support with designing research, feedback on findings, as well as the best routes for dissemination.
So I know that you're quite curious about sampling and recruitment as well. So just to give you a bit of an overview of our approach. So because, as Heidi mentioned, the aims of collecting qualitative research, so collecting rich data, which provides in-depth insights about the experiences and needs of certain groups or communities, rather than to produce generalizable findings from a sample of a larger population. Qualitative research tends to have a select group of participants to suit the research aims and resources that are available to the project team, which kind of translates basically to a smaller sample size in most cases. And whilst we don't aim to produce generalizable findings by having a representative sample, we do like to make sure that we're speaking to people with a range of views and experiences within our participant groups. And so we often use a sampling framework and participant characteristic mapping whilst we're going through our sampling and recruitment process. And that's known as purposive sampling. So that involves thinking about the personal characteristics and experiences which might be relevant to the research questions that we're looking to answer. So for example, with our research with gypsies and travellers, we wanted to explore lived experiences of home and housing and accommodation. So we included different types of accommodation within our sample framework, as well as different ages and different geographical locations, to really maximise the chances of capturing a range of experiences with housing and homes. So in recruiting participants for our research, we tend to work quite closely with the gatekeepers who already have existing links to the participant groups. And the advantage of this approach is that it increases trustworthiness of the research, and it also maximises participant well-being, because the offer of participation and the information about the research comes from somebody who is likely already known to the participant, rather than from an anonymous researcher from the National Statistical Office. It also means that contact preferences can be observed. So, for example, if a participant group is more likely to prefer being contacted over the phone or face-to-face, such as in the Gypsy and Travellers project, gatekeepers will be able to facilitate this, whereas we rely heavily on email and online communications. And finally, we always provide reimbursements for our participants because they give up their time and energy to be a part of our research. We always read the existing literature and consult with our advisory groups before coming to a reimbursement amount, so we can make sure that it's proportionate and ethical. And we tend to provide vouchers rather than cash when we're doing reimbursements. So one of the data collection methods that Heidi mentioned was focus group discussions. And an example, again, from the Gypsies and Travellers lived experience research, I think really demonstrates well how qualitative research can enable engagement with policymakers and local government as well. And they were our focus group discussion sessions. So these consisted of 5 sessions in person, and one occurred in each geographical location that our earlier interviews were held in. So the sessions were attended by Gypsy and Traveller community members that had participated in the earlier interviews, but also by employees from relevant central government policy departments, such as departments working on housing, health and education, and also by local authority employees. So we use these focus group discussion sessions not only to sense check the initial analysis of the earlier collected interview data, which feeds into the participant-led approaches, but also to collect additional data on experiences and to open up dialogue between community members and central and local government attendees. So that included discussions of issues raised within the interviews and potential ways of moving forwards.
And as we mentioned before, we've also used some kind of more creative methods, and we developed what we called a flexible toolbox of kind of creative and participant-led methods. These are just some examples of what could be included in the flexible toolbox. But yeah, the point is it is flexible. It's working with the participant, what their preferences are. And we're able to get feedback early on by testing out methods with expert groups, the expert by experience groups, and getting their feedback and ensuring that the methods selected are appropriate and will facilitate answering your research questions. These kind of participant-led approaches can address those traditional power imbalances between the researchers and participants, putting the control in the hands of the participants to really discuss their priorities and what's important to them, rather than strictly following a kind of predetermined topic guide developed by the research team. It can also help formalize the encounter. It makes it fun, a bit relaxed, can avert eye contact if focusing on creating a drawing or some Lego. And this was particularly useful when we were working with children and young people. So here's just some of the examples that we used in the project with young people with special educational needs and disabilities. Yes, we had the informal chat, which is always an option, and some just would much rather do that. We had lots of our table set up with lots of pens and pencils and Lego, and so drawings and Lego were other options that we used to develop an ideal school, so they could talk us through that. It could also, whatever your research question is, you can think about other things that could be developed that they could discuss with you, and you can ask probing questions throughout the process. Timelines, again, could be useful if you're looking at a journey. In this case, some of the young people we spoke to had been to lots of different schools, and this was really useful, like in comparing where they maybe had been from lots of different mainstream or special schools, different kind of educational environments. So they could write out the timeline, and then you leave it on the table, and it's something to also refer back to facilitate that interview process, and they can kind of talk you through their experiences as they go. And photo elicitation was another method that we used as well. where you have images that the participants can, they can pick up, and it kind of helps trigger memory a little bit about their experiences with a specific location. And so again, we use this for different areas of the school, like the cafeteria or the gymnasium or the auditorium, where again, young people would select the photo that they wanted to talk about and, explain their experiences. Then we could ask kind of some probing questions on that. So this image here is actually one of the outputs, the creative outputs, with one of our participants called David. David was the pseudonym, so we asked participants at the end of the interviews if they would like to select a pseudonym to represent them in the research. And this shows his ideal classroom that he developed. So again, he was leading the conversation, describing what he was including, and then we were asking those probing questions. What does this mean to you? Why do you feel this is important? And also around how, the ideal school or classroom or whatever they developed, how did that match with their actual experience? So again, he explained a little bit about these colored stripes in the pictures and how they represented the different rules of the school that they should have, including one, to make sure that kids did their homework, but not too much homework, that they should make the most of their education. And another rule was that people shouldn't be unkind to anyone.
So with our 3 already published pieces of work about disabled people, young people with special educational needs and or disabilities, and gypsies and travellers, a variety of different types of outputs, including accessible outputs, were produced. So in addition to detailed reports, we've also published shorter summary documents in both HTML and PDF formats. And to ensure that participants involved in our research would be able to access the findings, we produced an easy read version of the Disabled People Project and a young person friendly version of the Special Educational Needs and Disabilities Project. And for all 3 published projects, summary videos were produced as well, so those with any literacy issues would also be able to access the findings.
So along with a range of outputs, we also had a range of dissemination activities. So on the release day, we provide a media note and social media where content such as tweets and everything can be put out. And that's quite good in giving bite-sized findings and links to people to where they can find out a little bit more about the findings or about the information or anything about the research. For government departments who have an interest in our work, we work to kind of provide a teaching session with them to share some of our findings. And these sessions are particularly helpful for policymakers to understand our data, but also understand how they can use it going forward as well. So for previous projects, we did this with the Department for Health and Social Care, Department for Education, and the Disability Unit within Cabinet Office. We also like to present at research conferences. So in the past, we presented to the Social Research Association and the Government Social Research Network. And these tend to be more about the methods, but also around some of our learnings around inclusive practices and some of our considerations and recommendations kind of going forward, which we'll also touch on a little bit today. As well as the in-person events, we also like to do some online webinars like today, and that's just a little bit easier for people to kind of take in the information whenever they've got time, so it's just saved and stored somewhere. We also like to link up with civil society organisations, so charities, influential kind of organisations in the topic sphere, and this is to help kind of share our findings within the context of their own commentary. So, for example, they can pull out parts which are relevant to them. So, for the disabled people's release, thinking about if an organisation is impairment specific, working with them to put out a blog. We do like to tailor our dissemination activities for each topic, and we like to work with stakeholders and our advisory group to understand how best our findings can be shared with a range of audiences. So, for example, as Jenny's already been through some of the outputs that we do have, but thinking what more can we do in the future? How else can we get this out? So, for example, for the upcoming domestic abuse release, women who took part told us they might like to find out more through like a network coffee morning or any kind of community event to share some of our findings with a different type of audience.
So I know a topic of particular interest is kind of using qualitative methods alongside statistics within this session. as qualitative researchers, we obviously love to collect and use qualitative data on its own because of the many benefits which we've been through today. But qualitative data can really help you in terms of enhancing your statistics as well. So it can help before you collect statistical data. It can help you inform what to collect, from who, when to collect it, and how. It's also useful to use to complement statistical data. So numbers and human insights together make extremely powerful reading. Policymakers obviously want numbers to understand the scale of the problem, but increasingly so in the last few years as well. We're seeing people's stories as being really compelling and providing weight to given experiences and needs. And then after statistical data has been collected and analysed, it can help you to interpret it when you have a lot of data and you don't really know what it means or what the kind of links are, and to situate your statistics in a kind of social context. And at the ONS, we do qualitative research, and particularly with this team, because it helps to increase trust and trustworthiness with groups who aren't picked up by traditional statistical methods. And it means we learn more about people who might otherwise be excluded.
So this is a bit more of like a practical example of some of the stuff that we have done to link up some of the qual and quant stuff within the ONS and also wider around that. But I think mostly just to say, like as discussed, most of our research is designed with other government departments first of all, so we understand what the data gaps are and we've explored how our data can help fill those gaps. So many times there's an explicit data need for our qual work and the strategy for how it can align with other statistical work. So an example for that for the Disabled People's project, in working with the Disability Unit at Cabinet Office, they linked us up with another analysis team in the ONS who were working on a quantitative study on the same topic. So we could work with that team to see what questions we could fill in or what we could have answers to ensure that we were getting a fuller picture of people's experiences. And when it came to the release of the two research pieces, we ensured that they referenced one another so audiences could access both the qual and the quant. And then we did something a little bit more explicit. So we did a blog on the National Statistical blog, which kind of brought the two pieces together in more of a cohesive way, which was quite nice, rather than having two different publications. So for example, the quant piece could talk about what barriers people faced, and then the qual piece could pull in some of the quotes about the impacts of those barriers. And it was really powerful kind of having that blog and bringing those both together. So the two teams again also came together for a joint podcast. So a small plug for the ONS podcast, Statistically Speaking. And this primarily covered some of the census data, but also brought in some of the findings from our qual work as well. And then just finally, in using categorizations of things like ethnicity and disability as topics and as sample characteristics, we're able to find out a little bit more about what those definitions meant to different people. So for example, with disability, whether someone classed themselves as disabled and how they saw their impairment or felt about their impairment. So there's a wider body of work within the ONS which looks to harmonise categorisations such as ethnicity and disability and think about the consistency of definitions across the UK. So our findings, we were able to kind of feed those in and think about how people define themselves and how they viewed their identity. And that's also another way that we can feed into those type of consultations with qual work.
And to talk a little bit about how we can maximize the quality and rigor of our research, we actually developed a step-by-step methods manual for everyone who is involved in our projects to follow. So this starts from just at the beginning, scoping the project to completion and even beyond that. So we have used some government social research, so this is our profession in the UK, and ONS standards and guidance to help develop this manual, and even also our learnings throughout the projects that we have completed within the team. So it's an ongoing working document that we are continually kind of amending and improving as we go along. But yeah, so this published guidance and ethical consideration around inclusive practices, again published by ONS and government social research profession, were also used to inform the development of this manual. But some of the kind of specifics that we do as within our projects to ensure quality is, again, ensuring all the researchers that are involved have the relevant training, of course, and experience. We do deliver a lot of training in-house, and we have lots of opportunities for shadowing and observation, but we also have contracted experts that deliver bespoke training, and they also provide their input and feedback on our work. We work with lots of experts as well to ensure the appropriateness of our methods for each project, and ensure that the processes to undertaking that we have rigorous processes to maximize safeguarding and data protection and minimize safeguarding data protection and security risks. So this does include our advisory groups that we spoke about before, but also methodological and topic experts at ONS, and we also work with our data ethics teams, legal and data protection and security teams as well. All projects must have approval by the National Statisticians Data Ethics Advisory Committee before commencing, and so they also provide recommendations that we have to follow. We also have regular audits to ensure that we are kind of consistent with the recommendations. And again, we work with all these teams to identify any sort of potential risks and develop really strict procedures. So we have kind of step-by-step procedures for each project for the data handling, and making sure that these are always followed. We work within our team very collaboratively throughout the projects. Again, as Heidi mentioned, with our analysis, we do a double coding on a number of transcripts to develop that initial coding framework. We have regular meetings as the framework continues to develop throughout the analytical process. So it's a very much iterative approach as we move along to developing the themes. We work very reflectively as well, like as part of, for example, as part of the familiarization process with the data, with our recordings, we listen to the audios, we look at transcripts, we quality assure the transcripts, but we also take memos. And these memos will include our own reflections and reactions and any sort of possible assumptions that we are observing within ourselves. And we discuss these at our project catch-up meetings. And it helps us to kind of understand how we might be influencing any part of the data analysis process, so that we can also help work to remove that sort of bias. And once we have developed the early themes, we discuss these again with our experts groups, with our experts by profession and our experts by experience. And where they can comment and raise questions. And it helps us to also understand where any findings may be consistent or may contradict their experiences or their understanding of existing evidence, so that we can also go back to the data and explore anything in further detail.
So these are a few recommendations and considerations to keep in mind when conducting qualitative research. One of them being adapting interviews and materials to suit participant needs and preferences. So one strength of qualitative research is that because we had spoken to people about what suits them best, we were able to do this with our projects. It's important to consider having support from experts, as discussed earlier, so such as civil society organisation, experts in academia, etc. This has provided us expertise on how to design, feeding back on preliminary findings and dissemination. Another consideration is maximising trustworthiness. For example, by working with communities directly. With the Gypsy and Traveller research, we were able to maximise trustworthiness between the ONS and participants by ensuring data collection was carried out by trusted individuals and focusing on topics of importance to community members. We were also happy to achieve a diverse range of views and experiences within the data using purposive sampling. This also allowed for comparisons of experiences to be made between subgroups. It's important to consider understanding the influence of recruitment methods. If we are heavily reliant on gatekeepers such as schools and other networks to recruit eligible participants, this can lead to unintentionally excluding some individuals from participating. There needs to be a balance between having access and getting trust, but not limiting the breadth of the sample, because otherwise we may end up working with people they know for only a certain period of time. So for example, with the temporary safe accommodation project, there was a longer time frame built in for recruitment, and this sampling approach enabled greater sampling diversity. For example, we were able to request for more participants from older age groups and more participants from different geographical regions, and this ensures that diversity was achieved. Another important consideration is being inclusive with data collection methods. So this involves considering various needs of different groups and provide appropriate methods to collect data. For example, this could be online data collection, thinking about how questions can be presented and probed sensitively, and making sure research materials are accessible. Final considerations for qualitative research are ensuring there is sufficient time for engagement and collaboration. So members of expert groups such as civil society organisations, peer researchers and academics aren't necessarily able to work 2-hour timetables. So they may be overworked and have different priorities. So it's crucial to ensure there's sufficient time to engage with them fully and meaningfully throughout the process, and to be sensitive to their own schedules and their workload. Overall, so involving communities as early as possible in the planning stages and facilitating ongoing involvement throughout, to ensure research is done with and not on and is appropriate and sensitive. Also, it is important to be flexible. This involves accommodating to the diverse needs and preferences of communities. And so this is key to building trustworthiness and ensuring well-being of participants and collaborators. So thank you for listening. We'll now take questions, but if you have any after this session, please email them to qualities@ons.gov.uk, and keep an eye out for our upcoming publications.
Thank you all so much for the presentation, and congratulations on all the research projects. These are early works, but it seems like there have already been a lot of interesting results, and we look forward to following up with your projects going forward, of course. I invite everyone now to ask your questions. I have allowed you to turn on your camera and microphone. So please use the raise hands function at the top of your screen if you have any questions. Could I kindly ask you to also introduce yourself while you ask your questions? And if at all possible, please limit your intervention to one question. Any questions? Can I perhaps start with a couple of the questions in the chat box? I wonder if you would like to ask them yourself. So Rosina D'Alva, if you want to just unmute yourself and turn on your camera and ask your question. If not, I could also read it out. And this is a question, ONS colleagues, about the UN Disability Inclusion Strategy. The strategy recommends that focus group discussion researchers should consider having a person with disability as a facilitator, as it may help to make the participants more comfortable. The question is, what is your experience on this? What experience or expertise are to be considered, budget estimated, time for discussion, so on and so forth. So maybe we take this question before we allow people to come in with others.
Yeah, I'm happy to answer that. So for the disabled people's piece that we did, that was with disabled adults, and we did work with an expert kind of commission supplier for that as well. The format of those kind of that data collection was one-to-one interviews. So we did that because there's a variety of things we need to account for with people's impairments and being flexible and accessible towards that. So the interviewers themselves, to my knowledge, didn't have a disability themselves, but we did take into account some of the flexible, accessible needs of our participants. So, for example, we offered BSL, someone to have a personal assistant available or present with them during that interview to help them feel more comfortable. We also did quite a lot with the interviewers to make sure that they had that rapport built up with the participant ahead of the interviews. So we had, I can't remember what we called them, but we had check-in conversations prior to the interview itself. So people could talk through what the interview was going to be about, get to know each other a little bit. So trying to build up that rapport to make those interviews as comfortable as possible. And I think, like Heidi said at the beginning, they were kind of framed. We obviously had research questions and we had a topic guide to follow, but as kind of informal chats to, you know, the person's going to share exactly what they want to share and what's important to them. So hopefully that was done enough to make them comfortable. Hopefully that answers your question.
So I was just going to add to that as well, that what we have done with some of the other projects, including the Gypsy and Travellers project, it was community members themselves that, as peer researchers, that conducted the interviews, as well as with the displaced young people. So we were involved in helping to train and provide that ongoing support to other young people who facilitated the interviews with the participants, and then that way they're also able to have the interviews were held in the choice of language of the participant as well.
Thank you so much. We have a question as well from Betsy Williams from Stats New Zealand. First of all, thanks for joining us. It must be 2 or 3 a.m. in New Zealand. Do you want to come in and ask the question yourself, Betsy?
Sure, kia ora. I'm actually working from Florida right now, so the time isn't too bad.
Not too bad.
But I appreciate everything you've shared with us. And when we were doing a fairly small project a few years ago, we were trying to sum up qualitative data, and it looked like a lot of the work out there in academia, well, the things I'd been trained on were at the very high order of like grounded theory, and then how to actually implement that within our organization for just a couple people on a one-off project was pretty intimidating. So I've seen a few links you've posted to your work, and I'm curious if you have the protocols you talked about published so that others can use them as well. And thank you.
Thanks so much, Betsy. We haven't, I mean, our publications include kind of a very brief overview of the methods that we used, but including the analysis. The method that we kind of developed is actually almost like a mixture of, based on Braun and Clark's thematic analysis, but also Gale's framework, where we do develop that framework, the coding framework. And so what we put together as a protocol was like a step-by-step of what that looks like in practice for us. So exactly, the specific numbers of how many transcripts we want to look at, and double code and or quality assure as well. We haven't actually published that. It's not an official document, but I don't know if it would be a problem to share. I can inquire about that for you.
Yes, please. If that would be possible, that would be very helpful. Thank you.
Thanks for the question, Betsy. I have Stephen with his hands up. Stephen.
Yes, thanks to the presenter for the presentation. It was nice, but I think this seminar is more about inclusiveness, including, I think, probably including people from other areas. But I think most of what was discussed here, I think, is mostly about Europe. Is there any plan for more inclusion of people from Africa? Hello?
Okay, Stephen.
Am I being heard?
So in terms of like the groups that for our future groups that we'll be working with, is that just making sure I understand the question correctly?
Stephen, could you re-ask your question?
Yeah, okay. My question is about whether there will be more inclusion of people from Africa, because most of what was presented here, most of the examples and other things, I think is probably England, Europe, and I'm not hearing much about Africa. So is there any plan about inclusiveness
Okay.
of?
So yeah, I mean, this is specifically like groups that have been identified in the UK as being underrepresented in our data. Within the Inclusive Data Task Force recommendations that they have identified, and they've identified groups from specific ethnic backgrounds as well. We don't have any specific plans in place at the minute, but we will have kind of new work packages moving forward that, you know, we with a number of different groups, including other groups from different ethnic backgrounds.
I'll take two questions. I also want to say that there are a lot of echoes of requests for the protocols in the chat. So hopefully you will consider making them public as well for the benefit of other people. I'll take one from Howie, and then I will go to Hannah.
Me first, thank you.
Sure.
Yes, just the protocols, and also very much interested in the use case. After you disseminate and provide trainings to the government and policymakers, whether there's example that how they use the data, the qualitative and the quantitative, to maybe change the policy or modify it. And if you have example like that, that would be fantastic. Thank you.
All right, we'll take a second question from Hannah, maybe, before we go to you guys. Or do you want to take it first?
Yeah, that's fine.
Hannah?
Hi, thank you. Yeah, thanks for the presentation. Hannah here. I work for an NGO in the humanitarian sector. So we do a lot of both quantitative and qualitative research with very hard to reach populations in crisis regions. And I'm wondering, do you ever get any pushback on your qualitative data, especially when it's in comparison to maybe quantitative data out there? I think there's a lot of experience that we have at times where decision makers will kind of question the validity of findings based on qualitative data, have issues with the sample size. And, you know, you mentioned at the beginning, obviously the aim is not to be representative, but when you're making recommendations based off this data, I think it can be difficult sometimes to nonetheless communicate its usefulness. So I'm just wondering if you have experienced that and if you have any tips.
Yeah, thanks, Hannah. I think, yeah, to both questions could kind of be answered together. Firstly, around any sort of policy kind of changes or any sort of policy influence, and this also answers the second question a little bit, that I think, you know, we try to engage, you know, and yes, of course, it is always a fight, I think, for us, in terms of kind of, I guess, almost selling the importance of having this kind of research to, you know, government stakeholders and policymakers, but by involving them actually quite early on and making sure that we're including their key questions, I think that helps to kind of get that sort of buy-in as well. So one example of where we worked with the Department of Education and is, again, the timeliness of the work ongoing, the qualitative project. So there was an ongoing review of the special educational needs and disabilities system in England when we worked on the project, and they produced a green paper that was out for consultation. So we were able to kind of feed into that consultation and ensure that the young people's views were involved in that. But also, you know, we had feedback as well that, you know, as part of that system, local authorities and working alongside the Centre for Disabled Children were developing what is included in ordinarily available provisions. So how it works in England is you have, you know, where a young person might be identified as having special educational needs and disabilities, some, you know, may need to have additional funding where they get an education, health and care plan, but others don't necessarily have that additional funding. And they develop what is called ordinarily available provision, so what can be provided without having that extra funding. And so we're able to kind of provide some examples of you know, for example, how to you know, improve inclusiveness in schools, or how to kind of, you know, facilitate flexible support that came from, you know, the participants themselves. And then we were told that this publication was used in helping develop what would be included in these documents for ordinarily available provisions. I don't know if there's any more examples from the other projects that anyone else wants to come in on.
Not really. I was just going to add, I guess, to that second question. It's quite interesting as well, I guess, kind of what organisation you're in and how people react to qualitative research. And we're quite lucky with Surrey and Diamond being quite a big fan of qualitative research and really appreciating the difference that it can make to alongside some of those stats. And I think last week it was the Policy Festival where he did a presentation on qualitative research for policy development. So it's really great to have that kind of representation quite high up in the office to kind of make that headspace for us. I think you might be on mute.
Yeah,
sorry.
Panya, I think you're on mute.
Oh, sorry, I thought Ursula was on mute. It was me who's on mute. Ursula, can you come in with your question?
Sorry for that, the system is very slow. Hello, my name is Ursula Tiltanchat. I'm from the European Union Agency for Fundamental Rights. Thank you very much for sharing your experience and this presentation. We are doing surveys on how to reach populations. And my question at the Fundamental Rights Agency to complement the official statistics in the European statistical system. My question is what are the possibilities for you to expand your experiences to quantitative data collections and to other groups which you have not covered, so more for instance population in institutional households and persons like homeless persons, etc., and about the quantitative side of it to include your experiences in official statistics. Thank you.
So we do have a team within ONS that is dedicated to work on non-household populations. I don't know, Heidi, if you can talk a little bit about that. It was the team that Heidi used to work with.
Yeah, I guess in terms of just thinking in terms of the qualitative work, I think there's definitely opportunities in that space. I think it's in terms of sort of reaching out to maybe non-household populations, it's always quite a difficult one, particularly in terms of kind of recruitment, I guess. And I think particularly some of the some of the communal establishments are maybe a little bit easier in that sense, but some of the other kind of special populations outside of those communal establishments are much more tricky to reach, I guess.
Thank you. We have a couple of minutes, so I will take one last question if there is still any interest from the floor. Do raise your hand if you want to ask one last question. I don't see any hands, so an hour has gone. It's been certainly very useful to hear about all your experiences at the ONS, and I hope that everyone in this webinar will have taken something useful from it. Before we finish, can I just ask for a small favor from all the participants? If at all possible, could you unmute yourself, turn on your cameras to show some appreciation to our speakers and to let them know that we're just not black boxes, and give them all a big round of applause. Thank you all so much.
Thank you for having us.
Thank you.
Thank you.
Thank you.
Look forward to continue our collaboration.
Thank you.
Thank
I think
you
we
to all
will
the
be working
speakers
together a
for
lot.
taking
Thank
time.
you.
Definitely.
Thanks.
Thank you.
Thanks everyone for joining, and look forward to the next webinar in a couple of weeks.
Thank you.
Bye.
Bye.
Thank you.
Bye.
Thank you.